Hello, everyone, and welcome to our nutrition and wellness for myeloma chapter. My name is Audrey Burton-Bethke, and I am the Myeloma Crowd Community Manager. I'm going to be sharing some slides with you today. So let's get started. Just give me 1 second to get this up and ready. All right. So as I said, welcome to the Nutrition and Wellness for Myeloma chapter. This is brought to you by the Myeloma Crowd Community Program by HealthTree, and my name is Audrey, and I am the Myeloma Crowd Community Manager. We are really privileged to hear from Dr. Robert Ostfeld today, and I will introduce him formally in just a moment. Today's session will be recorded, and it will be sent out to all registrants within 48 hours of the event's conclusion. A special thanks to our community event sponsors, without whom this would not be possible: Bristol Myers Squibb, Amgen Oncology, Genentech, Adaptive Biotechnologies, Sanofi, Oncopeptides, Karyopharm Therapeutics, and Takeda Oncology. Today's topic is going to be proper nutrition for a healthy heart with Forks Over Knives author Dr. Robert Ostfeld. Dr. Shah is an amazing multiple myeloma specialist. If you guys know her, she's currently practicing at Memorial Sloan Kettering in New York, and she is the one who helped co-found this Nutrition and Wellness for Myeloma chapter. She launched it off with 2 awesome sessions talking about what are modifiable risk factors for multiple myeloma patients, one of them being obesity and other things that affect what am I trying to say? Just basically how it affects your myeloma and your myeloma journey. Nothing like breaking into an important event with some brain freeze, but and then she also brought up some amazing studies and shared with us how plant-based eating really improves outcomes even when it comes to myeloma. So throughout the year, she's been connecting us with really important names and important voices in the plant-based eating community. And today, one of those people that's joining us is Dr. Robert Ostfeld, and he's going to be talking to us about the importance of proper nutrition and how it can lead to a healthier heart. It is now my pleasure to introduce him to you. Robert J. Ostfeld, MD, MSc, FACC, is the Director of Preventive Cardiology at Montefiore, I forget how to say it.
Good.
Thanks. Health System as a professor of medicine at the Albert Einstein College of Medicine. Dr. Ostfeld treats patients with adult cardiovascular disease, including coronary artery disease, hypertension, hyperlipidemia. I practice these words and then it's so embarrassing when I butcher it. And erectile dysfunction, with the focus on prevention and treatment through lifestyle change. He works closely with his patients to help them adopt a plant-based diet. Dr. Ostfeld received his Bachelor of Arts in the Biologic Basis of Behavior from the University of Pennsylvania, graduating summa cum laude and Phi Beta Kappa, and his Doctor of Medicine from Yale University School of Medicine. He then did his medical internship and residency at the Massachusetts General Hospital and his cardiology fellowship and research fellowship in preventive medicine at Brigham and Women's Hospital, both teaching hospitals of Harvard Medical School. During his cardiology fellowship, he earned a Master's of Science in Epidemiology from the Harvard School of Public Health. Dr. Ostfeld's research focus is on cardiovascular disease prevention and reversal through lifestyle modification. Ongoing topics he investigates include the impact of plant-based nutrition on erectile function, coronary heart disease, angina, and heart failure. His work has been published in peer-reviewed journals, books, articles, and clinical statements, and has been presented nationally. Dr. Ostfeld is board certified in cardiovascular disease and echocardiography, and is a member of numerous professional societies, including the Physicians Committee for Responsible Medicine and the American College of Cardiology. So with that being said, I'd love to turn the time over to you, and sorry again for butchering those pronunciations.
Well, we have a lot of tongue twisters in cardiology, so we do that just so we can sound fancy.
Right.
But I really appreciate that generous introduction, and thank you. It's an incredible honor to be here with you today. And Dr. Shah is a great friend and an incredible inspiration. And so I'm always happy to join her in anything that she's doing. And so thank you again for having me. And it's an honor to be here with you today. I'm going to try to figure out if I can get, there we go. Hopefully y'all are seeing that, my screen. Okay, wonderful. So let me just get my, okay, I'll try to go for around 40 minutes and maybe skip a couple slides or something along the way. And we can obviously circle back with questions and answers. So we're going to talk about a plant-based diet and cardiovascular health. So, I'm a cardiologist, and I, spent a long time in training, much like Dr. Shah, med school residency fellowship, and learned a lot of great stuff, but honestly learned very, very little about nutrition, which is unfortunately very common, although changing more recently. And so I kind of knew when I was done with all those years of training that a Mediterranean style diet was good, but I couldn't really define it, and that was about that. And so I came down to Montefiore to work and did all the things I was trained to do, procedures, medications, that kind of stuff, and said maybe have a Mediterranean style diet. And people got a little bit better, but they didn't get a lot better. And I didn't go into medicine to help people get a little bit better. I wanted transformational change. So I really started getting disillusioned. I'm like, what am I doing? So it's right around then that actually somebody handed me the book, The China Study. And being a myopic cardiologist, I went right to that small section in the middle that's about cardiology. And I was very taken by the impact of plant-based nutrition. And one thing led to another, and started our cardiac wellness program at Montefiore with the goal of preventing disease with a plant-based diet. And I say disease, not just heart disease, because yeah, it's good for your heart, but it's good for you for dozens and dozens of reasons, of course. And now quite literally have patients crying tears of joy in our office. They feel so much better. Like nobody cried tears of joy in my office before doing that. And I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides. So it's really been rejuvenating for me professionally, but more importantly, it's been a wonderful thing to bring to patients and hopefully beyond. So I thought I'd start with a case that we published, and it was one that I saw pretty early on. We started our program, I think, around 2010. I saw it early on in our program, and it helped me realize that we were on a pretty good path. This is a guy who he was 60, he was having chest pain, even sometimes when he sat still, and he went to go see his regular doctor, and his regular doctor did a stress test where he ran on a treadmill and had chest pain, and the stress test was positive. And it's only in medicine where the word positive means something bad. So it showed that he had evidence of blockages in the blood vessels in his heart with poor blood flow to the heart muscle, to the heart muscle. So he told his doc, well, okay, but I don't want to take any medications. He wouldn't take an aspirin. He wouldn't take a statin. These are not things that we recommend. We recommend taking those things in those situations, but patient's the boss. And he also recommended the patient didn't want to have any procedures like a catheterization or anything like that, which can sometimes be very helpful. But that was patient's choice. And so in that milieu, he came to meet us, and he was a little overweight, not a lot. His blood pressure was a little high. His LDL cholesterol was high, and he could walk on average about 1 to 3 blocks and he'd stop because he'd get chest pain. So all we had is he wouldn't take any medications or have procedures. What we had was lifestyle change. So he adopted a smartly or minimally processed plant-based diet. And what we're going to do is we'll loop back to him later to see how he did. And when I'm talking about a plant-based diet, what I mean is minimally, or some people say smartly processed plant-based foods. So tons of vegetables, fruits, whole grains, beans, lentils, tofu, yams, nuts, and seeds. So that's generally what he ate. And in regard to health, the choice, of course, is yours. Which path do you want to go on? And of course, a path in this direction would be much more aligned with at least the American College of Cardiology's nutrition guidelines. So heart attacks happen there's about 2 heart attacks happen every minute in the US. So we've been talking, let's just say, for 5 minutes. So that's 10 heart attacks. 10 heart attacks have happened in the US during that time. And a heart attack is when part of the heart muscle dies because of a cholesterol blockage. It's the #1 killer of adult men and adult women in the US. COVID may have overtaken it briefly, unfortunately, over the last year. But for the 100 years before that, it was #1 killer. And I think it's back up to being #1 now. It's a title no one wants. And women are about 6 to 7 times more likely to die from heart disease than they are from breast cancer. Now, clearly, you do not want either one, but it highlights the epidemiologic importance of heart disease for women. And unfortunately, on average, fewer than 50% of women know that heart disease is the leading cause of death, which is unfortunate. It's a very expensive disease process as well. And there's really no audience response. Normally, I would do a little Q&A here, but and ask what percentage of kids between ages 12 and 14 have early signs of cholesterol disease in the blood vessels that feed the heart with blood. And it's about 65% of kids between the ages of 12 and 14 have some degree of a little bit of cholesterol disease in the blood vessels that feed their heart with blood. And we know this from pathology studies of kids who died for other reasons, and they did an autopsy of the heart. But that's okay, you don't have to worry because it gets worse. In some famous autopsy studies of Korean War veterans, these are soldiers, US soldiers, prime of life, 21, 22-ish years old. 77% of them had overt cholesterol blockages in the blood vessels that feed their heart with blood. A study of Vietnam War veterans, or people who died in the Vietnam War, also soldiers, young, mostly men, were 45% had overt blockages. And this is a more recent study of consecutive trauma victims, about 111 of them, average age about 26, and 78% of them had overt cholesterol blockages in blood vessels in their hearts. So this is quite the epidemic. And I'm glad you all are very, very interested in living more healthfully for all sorts of reasons that are, it's great that you're pursuing this path. A little bit of pathophysiology. This is an artery here, and this is the blood flowing through the artery. This is the wall of the artery here. Yeah, this is a picture. Actually, this is a little better picture here. This is the wall. This is the artery where the blood is flowing. This is the wall of the artery. These are the endothelial cells which line the wall of the artery. We want to keep them healthy. Why? So in part, so we can avoid getting a cholesterol blockage like that. But what happens is with these endothelial cells, they can become injured, whether that's through inflammation or pollution, smoking, toxic Western diet. And when they become diseased, cholesterol particles like this little yellow dot here can burrow across the endothelial cell into the wall of the artery, where it can become oxidized like a splinter and be kind of irritating. And that would cause more inflammation, make the endothelial cells less healthy, call in more inflammatory cells. And a plaque here can grow and grow until one day, the little thin fibrous layer that is created on top of the plaque that separates all this cholesterol plaque from where the blood flows, it can crack because of all that inflammation and oxidative stress. And when that happens, all of this cholesterol plaque here gets exposed to the blood and it can clot it off. So here you can see a picture of an artery, a lot of cholesterol plaque, and the fibrous cap here got thinner and thinner and weaker until one day it cracked, exposing all of this cholesterol plaque to where the blood flows and clotted it off. And this person, of course, died. This is a picture of a heart. This is an artery in the heart. And this is here where plaque ruptured, causing a clot and blocking blood flow to the heart. This is an emergency when this happens. You want to go straight to the cath lab and get a stent if you're having a heart attack like this. So there's a lot of opportunity in regard to lifestyle change. In particular, 90% of the risk for myocardial infarction or heart attack can be accounted for by these following 9 risk factors: abnormal lipids, smoking, high blood pressure, diabetes, abdominal obesity, psychosocial factors, consumption of fruits and vegetables, alcohol, and regular physical activity. And I put asterisks by the ones that are at least in part impacted by lifestyle and in particular diet. Um, so there's a lot of opportunity for us to bend the curve and reduce the risk for heart attack and myocardial infarction. But we really have a long way to go. And this is a very interesting study where they tried to look at the impact of optimizing different risk factors on future risk of heart attack and stroke. And they looked at these 7 risk factors: smoking, body mass index, physical activity, healthy diet score, total cholesterol, blood pressure, and measure of diabetes. And they found, and when they split it into 3, so either were poor, intermediate, or ideal for each one of these. Poor gave you 0 points, intermediate gave you 1, ideal gave you 2 points. And so they calculated where you were. And not surprisingly, the higher the points, that more closer to ideal, the better people did. And we'll dive into that in a moment, but let's look at the healthy diet score here. And that was defined by 5 things: 4.5 or so servings of fruits or more of fruits and vegetables a day, low salt, 2 or 3 servings of whole grains a day, fish and a couple servings of fish a week, and not having highly processed junk food. So if you had 4 or 5 of those components, you had ideal healthy diet score. So let's see here. Well, in this analysis of about 11,000 people, 0.7% of them had an ideal diet, 0.7. And poor diet was about 75%. So we really have a long way to go, which makes me, sometimes you see online these crazy diet wars of should be 99 or 98% plant-based. I mean, we're not even within a mile of that as a society. So I think our focus should be bending the curve for everybody. And in terms of the total cardiovascular health score, so you were high if you had 12 to 14 points and low if you had 0 to 8 points. And unfortunately, only about 7% of the US had a high score and over 50% had a low score. And if you took everybody in this database and this is an epidemiologic model, but gave them all the healthy diet score, the 4 to 5 points, you would lower the future risk of cardiovascular events like heart attack and stroke by a little over 40%. That's a lot. And if you just got blood pressure to the ideal range, you would also lower future cardiac risk by about 40%. So really quite impactful, these changes. And in this interesting analysis, in this interesting analysis, they looked at whether if you adhere to physical activity guidelines and dietary guidelines, if that would be helpful in regard to metabolic syndrome, reducing metabolic syndrome. Metabolic syndrome is a cardiometabolic disorder where it's defined by having obesity, insulin resistance, high sugar, not optimal cholesterol, and high blood pressure. And so in this analysis, if you adhere to the physical activity guidelines, regular exercise, you had about a 34% lower hazard of having metabolic syndrome. If you just adhered to dietary guidelines, from 2015, you had about a 32% lower hazard. And I forgot to put the number in, but if you adhered to both, you had, I believe, less than a 50%, you had a 50% reduction in your hazard for developing metabolic syndrome. So these things are additive and go together. And kind of where our worlds may overlap a little bit, clearly a healthy lifestyle is important in regard to cancer. And I'm obviously not a cancer specialist, so I don't want to get ahead of my skis on that one. But if you look at different cardiovascular risk scores, the American College of Cardiology has developed this risk score where you can estimate based on things like blood pressure, cholesterol, age, smoking, someone's 10-year risk of having a cardiovascular event like heart attack or stroke. And you can see here, this group with this color had less than 5%, 5 to 7.5, 7.5 to 20, and more than 20% future risk. And what they were looking at is, what does the level of risk have on the risk of future cancer diagnosis. So the greater your cardiovascular degree risk, the greater your future risk of developing incident cancer. So these things go hand in hand. So let's dive a little bit more deeply into the impact of a plant-based diet on cardiovascular health, and we'll look at a variety of other risk factors as well, and the endpoint of mortality. So this is a very interesting study from Dr. Du, and what they did here is they looked at like 450,000 people, and they asked, if you eat more fresh fruit, is it helpful? Is it not helpful? Well, it turns out in this database, it was helpful. The more fresh fruit that you ate, the lower your future hazard of cardiovascular death, stroke, and this is a prospective cohort. They had 3.2 million person years of follow-up. If you follow me for 1 year in a study, that's 1 year of follow-up. They had 3.2 million years of follow-up. That's pretty impressive. And of course, we're really talking about minimally or smartly processed plant-based foods. I mean, is there a difference between kale and sugar cookies? Well, there is, and this study really reinforces it. It's a wonderful study by Dr. Satija, where they looked at a little over 200,000 patients, I believe, with 4.8 million person years of follow-up. And they asked, if you eat a plant-based diet, is that helpful? Does it lower your future risk of cardiac disease? And if you look here, this is the plant-based diet index. The more of that you did, the better you did. But what if you ate sugar cookies? And what if you ate kale? Does it make a difference? Well, here, this red line is the healthy plant-based diet index. And this line is an unhealthy plant-based diet index. So this is the kale group, and this is the cookies group. And if you look here, the more of a healthy plant-based diet you ate, the better you did. And the more of an unhealthy plant-based diet, the worse. And if you compare it to animal foods, in this database, if you ate a healthy plant-based diet, you did better. And if you ate animal foods, this is how you did. But if you ate basically the cookies, the unhealthy plant-based diet, you did even worse than the animal foods. So the devil's in the details. So we're really talking about a minimally processed plant-based diet. And along those lines, carbohydrates or carbs, sometimes it's like a four-letter word even. So we're really talking about whole grains being helpful. And a whole grain keeps these three layers, the bran, the endosperm, and the germ. The bran having lots of fiber and a variety of nutrients, the germ having all kinds of nutrients, and the endosperm is a starchier part. But when it's a very processed, like white bread or sugar cookie, they get rid of the germ and they get rid of the bran, and they just keep the endosperm, stripping away a lot of fiber and nutrients. So that would not be a healthy grain. And in a meta-analysis of over 135 million person years of follow-up, more whole grain consumption was associated with less colorectal cancer, less heart disease, less diabetes. So let's take a look at stroke, another cardiovascular outcome. And how about the quality of a plant-based diet and the risk of total ischemic and hemorrhagic stroke? Ischemic stroke is when there's poor blood flow to the brain, and a hemorrhagic stroke is when there's bleeding into the brain. And for a healthy plant-based diet, if you ate more of a healthy plant-based diet, that was associated with about a 10% lower hazard of having it. And an unhealthy plant-based diet was neutral, but a trend toward more. Oh yeah, this is a busy slide, but it's a really interesting study because the thing that I often hear in my office is, hey, Dr. Ostfeld, my mom's got heart disease, dad's got diabetes, it's my genes, it's going to happen. Well, genes matter, of course, but lifestyle matters too. And this study touches on that. And this is the risk of coronary events according to genetic and lifestyle risk in prospective cohorts. So what they did is they put people into 3 levels of genetic risk: low genetic risk of future cardiac events, an intermediate, and a high genetic risk. So not surprisingly, if you had a high genetic risk, you had more likely to have a cardiac event. Okay, but what was interesting about the study is then they split people into different lifestyles: an unfavorable lifestyle, an intermediate lifestyle, and a favorable lifestyle. And if compared to an unfavorable lifestyle, still in the high genetic risk group, if you had a favorable lifestyle, you lowered your future risk of a cardiac event by about 50%. So genes matter, but lifestyle matters too. And to get into the favorable lifestyle group, one of the things you had to do is exercise at least once a week. And you had to eat more healthily than about 50% of the people in the study. So imagine if you ate more healthily than 75% of the people in the study and you exercised more than once a week. You'd imagine that the risk would be even lower. So lifestyle, genes matter, but lifestyle matters too. So how about cholesterol, inflammation, and blood pressure? Risk factors for cardiovascular disease, and we saw from the ACC risk score may also be associated with incident cancer. So here's a direct comparison of the dietary portfolio of cholesterol-lowering foods with a statin in hypercholesterolemic patients. This is a pretty cool study. They randomized just 34 patients, but the portfolio diet is a plant-based high-fiber diet with some soy, like tofu. And what they did is that they saw that the statin lowered LDL cholesterol about 33% in this study. They used lovastatin. But the portfolio diet lowered it about 30%. So very close to, it was a low dose of a not super intense statin. So pretty close. So the cholesterol can be lowered pretty significantly, in this study at least, from a minimally smartly processed high fiber plant-based diet. And they did a similar study, effective a dietary portfolio of cholesterol lowering foods given at 2 levels of intensity of dietary advice on serum lipids and hyperlipidemia as a randomized controlled trial. And they had 3 arms. One arm was just a control diet, just please eat more healthfully. Another one was the portfolio high fiber plant-based diet with routine dietary advice, like maybe seeing the dietitian every now and again, with the same diet here with intensive counseling, so talking to the dietitian a lot. So the counseling didn't seem to matter, but the diet did. And you can see that the LDL cholesterol lowered a good bit in the dietary portfolio, but not anywhere near as much in the control diet. And this is an interesting study out of Korea, the association between different types of plant-based diets and risk of dyslipidemia. They define dyslipidemia or abnormal cholesterol or not optimal cholesterol broadly, but at any rate, basically what they found is in the highest quintile of a healthy plant-based diet versus the lowest quintile, you had a 37% lower hazard of developing dyslipidemia, but an unhealthy plant-based diet, you had a 48% greater hazard. And plant-based diet improves a variety of risk factors. We talked about how oxidized LDL particles, when they get into the wall of the artery, may be particularly atherogenic or damaging to the endothelial cell, progressing atherosclerosis. Well, in an interesting study of vegetarians versus omnivores, it was more difficult to oxidize the LDL particles of the vegetarians. CRP is a blood test of inflammation. And in an interesting randomized controlled trial called EVADE-CAD, they took people with stable cholesterol blockages and randomized them to either the American Heart Association diet or a plant-based diet for 8 weeks and looked at CRP at the end. And guess which one won? The plant-based diet. Plant-based diet lowered CRP significantly more than the American Heart Association diet. How about blood pressure? Well, there are a number of randomized controls. The DASH study is a dietary approach to stop hypertension, which is a primarily, but not completely plant-based diet. But when you're randomized to the DASH diet versus control diets, it significantly lowers blood pressure. And this is further supported by various epidemiologic studies. In the Cardia study, eating more plant-based nutrition was associated with lower incident high blood pressure, as well in the EPIC Oxford study, eating more plant-based food in a cross-sectional way was associated with lower blood pressure. How about weight? Well, this is a Seventh-day Adventist study, and it's a wonderful study of Seventh-day Adventists. I think this analysis looked at about 60,000 of them. And the Seventh-day Adventists, that's a religious organization, and they treat their bodies like temples. And even those who eat a Western-style diet typically eat a more healthful Western diet than the average Westerner. And so, but they had a lot of different dietary patterns. And they looked at body mass index by dietary patterns. They had non-vegetarians, semi-vegetarians, pesco-vegetarians, lacto-vegetarians, and vegans. You can see the only group with a normal BMI of less than 25 here was the vegans. And this is interesting randomized control trial, comparative effectiveness of plant-based diet for weight loss, a randomized control trial of 5 different diets, a 6-month small randomized controlled trial of vegan, vegetarian, pesco-vegetarian, semi-vegetarian, omnivorous. And the vegan diet lowered, the weight fell more, significantly more compared to pesco-vegetarian, semi-vegetarian, omnivore, but not statistically significantly more than the vegetarian arm. How about diabetes? Well, the Seventh-day Adventist study, again, you can see the group with the lowest percentage with diabetes was the vegans here. And here's a plant-based dietary patterns and incidence of type 2 diabetes in US men and women. Results from 3 prospective cohorts. They combined it. They had over 4 million person years of follow-up. And if you looked at the healthy plant-based diet, the hazard, if you were in the highest versus lowest decile, you had a 34% lower hazard of developing diabetes, whereas an unhealthy plant-based diet had a 16% increase risk of developing diabetes if you're in the highest versus lowest index of an unhealthy plant-based diet. How about, okay, well, what if you change your diet? Changes in plant-based diet index and subsequent risk of type 2 diabetes in women and men. This is almost 3 million person years of follow-up, and each 10% increase in a healthy plant-based diet over 4 years was associated with a 9% lower risk of incident diabetes. So it seems like it's never too late to start. And other epidemiologic studies, just in the interest of time, I'll go quickly, support a similar theme: more plant-based foods, less animal-based foods associated with less incident diabetes or less diabetes. In a randomized controlled trial done by Dr. Barnard's group, they randomized 99 subjects with type 2 diabetes to either a plant-based diet or the American Diabetes Association diet for 22 weeks. And the plant-based diet, they lost more weight, their LDL cholesterol fell more. And for those individuals who had no medication changes, the hemoglobin A1C, or the blood measure of diabetes, fell significantly more in the vegan arm compared to the American Diabetes Association arm. Overall, there was a trend, although not significant for the plant-based arm, but a lot of people in the plant-based arm had medications reduced because they didn't need it as much anymore. That really interesting prospective cohort study out of China by Dr. Du, they also looked at incident diabetes, and I'm kind of getting tired of hearing about how fruit causes diabetes. And so they found that if you ate more fresh fruit, you were significantly less likely to develop diabetes. But what if you actually had diabetes at the get-go? And if you ate more fruit, is that good or bad? Well, they had 30,000 people with diabetes at the get-go, and the more fresh fruit they ate was associated with lower all-cause mortality. So I'm getting tired of hearing that fruit causes diabetes. How about some novel risk factors in quality of life? I think I'll talk about a couple of these and then maybe come back later. But so I'll talk about the first two. So genes obviously are very important. In a very interesting study of prostate cancer done by Dr. Ornish, they took people with early stage prostate cancer, about 30 of them, and followed them for a number of weeks and gave them a plant-based diet. It wasn't a randomized control trial, but they biopsied the prostate at the beginning and they biopsied the prostate at the end. I'm blanking, I apologize. I think it was about, I forget how many weeks. Now I think it's about 12 weeks, but I'm not 100% sure, I apologize. But they biopsied the prostate at the beginning and the end. Now, we can't change our genes, they make our hair color, eye color, but maybe we could change which ones speak. Well, after about 3 months of the plant-based diet in this study, many pro-cancer genes in the prostate were downregulated in their expression, and many anti-cancer genes were upregulated in their expression, simply from this lifestyle change. The lifestyle change was almost exclusively a plant-based diet, psychosocial support, and exercise. Not a randomized trial. But so very interesting. So we can't change our genes, but we may be able to change which ones speak. And the microbiome, of course, we're learning is associated. There's trillions of gut bacteria in us, and they're intimately related to our health. They may be anti-inflammatory, may reduce diabetes, may help with vascular disease if you have a healthful microbiome. And a plant-based diet with more high fiber foods seems to promote a more healthful microbiome, supporting your health overall. How about changes in a plant-based diet and quality and health-related quality of life in women? Does it impact just general quality of life? And they use this SF36 questionnaire to assess that. So increases in the healthy plant-based diet index is associated with improvements in physical and mental health. Pretty cool. How about mortality? Let's see, how am I doing on time? Okay, pretty good. Changes in plant-based diet quality in total and cause-specific mortality. And this is a prospective cohort with a little over 700,000 person years of follow-up. And compared to persons whose indices remain stable, among those with the highest quintile in diet scores, there was a 10% reduction of reduced hazard of mortality for the healthy plant-based diet, and a 12% increased hazard in mortality for an unhealthy plant-based diet. Fruit and vegetable intake and mortality from 2 prospective cohort studies. So they found that, and this is a pretty recent study, 2021, 5 versus 2 servings a day was associated with a 13% lower hazard of mortality. And a similarly done meta-analysis with follow-up ranging from about 5 to 30 years, there was a similar 13% reduction with consuming more fruits and vegetables versus less. And in a separate meta-analysis with 16 prospective cohort studies with over 800,000 people, each serving of fruit and vegetables per day was associated with a 5% reduction in mortality. Oh yeah, and this is a really cool study by Dr. Song. Now, you don't have to have perfection be the enemy of good. And this study really reinforces that every little bit counts. And so what they asked in 130,000 people with over 3 million person years of follow-up is if you replace even just 3% of your calories from animal protein with plant protein, is it helpful? Is it not helpful? Well, it turns out it's helpful. In this study, if you replace just 3% of your calories from processed red meat with 3% of calories from plant-based protein, that's associated with a 34% lower hazard of death. Unprocessed red meat, replacing 3% of that with 3% of calories from plant-based protein, is associated with a 12% lower hazard of mortality. In this study, for poultry, 6%, fish, 6%, eggs, 19%, and dairy, 8%, all statistically significant. As you know, processed red meat by, I believe it's the World Health Organization, has been labeled a class 1 carcinogen, and unprocessed red meat a class 2A carcinogen, meaning we kind of think it causes cancer. So circling back to our guy who had chest pain and had a positive stress test, but wouldn't take any medications or procedures. So he went fully smartly plant-based diet. You can see he lost weight, his blood pressure normalized, his LDL cholesterol fell a ton. And this is about 3 months later. It's hard for me to see because of the share screen stuff up top. But he went from walking 1 to 3 blocks and he'd walk a mile and then he'd stop because of shortness of breath. Fast forward about a year, his numbers look good, cholesterol fell a little bit more, and he could jog 2 miles. And I bumped into him a few years ago, and he jogs 4 miles now and he stops because he gets bored. And so we can touch on some other dietary patterns. A Mediterranean style dietary pattern, which is largely plant-based, but also has some fish, poultry, lean meats in it, is a very well studied, excellent study for excellent diet for cardiovascular health, certainly compared to a typical Western diet. And the Lyon diet heart study reinforced that. This was in people who already had heart attacks, and the Mediterranean versus a more typical Western diet profoundly lowered future rates of heart disease. And the PREDIMED study, which was a randomized controlled trial of people at risk for heart disease but without overt heart disease, found that a Mediterranean style diet significantly lowered future cardiovascular events, mainly stroke, which is important, compared to a more typical Western diet. But interestingly, it appears that under the umbrella of a Mediterranean style diet, the more plant-based someone goes, the better they do. And in a priori defined post hoc analysis of the PREDIMED study with about 7,000 people, they thought, well, let's see if people had a pro-vegetarian dietary pattern. Is it helpful? Is it not helpful? Well, if you were in the highest quintile of a pro-vegetarian dietary pattern there, meaning no animals versus the lowest, you had a 41% lower hazard of death. And in the Greek epic prospective cohort study with 23,000 people and about 8.5 years of follow-up, the higher your Mediterranean diet score, the lower your mortality. And they had enough people, they could look at what more specifically was it driven by. Well, it was driven by moderate alcohol intake. There really is no level of alcohol intake that is safe for cancer, that to my knowledge. It's driven by low meat consumption, high vegetable consumption, high fruit and nut consumption, high monounsaturated saturated fat ratio, meaning more plants, high legume consumption, cereal and dairy had minimal impact, and fish and seafood was really neutral, but with a trend toward increased mortality. And see if I can remember this. Yeah, this is a Mediterranean diet and low-fat vegan diet to improve body weight, a cardiometabolic risk factor randomized controlled trial. And this was really interesting 16-week crossover randomized controlled trial. They looked at a Mediterranean diet versus a low-fat plant-based diet, and they found that people lost significantly more weight on the plant-based diet. They didn't lose weight on the Mediterranean diet. Cholesterol fell more in the plant-based diet. However, blood pressure fell more in the Mediterranean style arm, although it did fall some in the plant-based arm. And overall, though, it appears that the more plant-based the Mediterranean diet, the more optimal. And I'll touch a little bit on this slide, then I think we can maybe break for maybe a couple other slides, but then I'll break for some Q&A. So a diet that gets a lot of attention is an animal-based ketogenic or low-carb dietary pattern. And to me, that diet, the foundation, not really, but the foundation is based on a popular myth. And that myth was that in 1979 or 80, they told us to eat low fat, and look at us now, we're fat and sick. Well, they may have told us to eat low fat, but we didn't do that. We ate more of everything, including fat. So I think that premise is fake news. There's, to my knowledge, no long-living society that lives in a state of chronic ketosis. Now, there's some romanticization of the Inuit population that live near the poles, North Pole, and they are romanticized to have very low rates of heart disease. And they eat a lot of fish because it's kind of hard to grow strawberries up there. It's not true. They have the similar heart disease rates as typical Canadian. And also, if you look at the blue zones are 5 zones throughout the world where people live the longest or have the most centenarians. And the way they get there is, they have an impressive lifestyle, a lot of social support, physical activity, but their diet is more than 50% carbs, more than 50% complex carbs. It's clearly not a low-carb diet. And those are the places in the world with the most centenarians. And interestingly, the Tsimane people, which are an indigenous population in Bolivia, they have the lowest rates of heart disease ever recorded in the medical literature, and I looked it up with CAT scans. Their diet is 72% complex carbs. Now, of course, they're an indigenous population. They're quite physically active. They have a different kind of lifestyle as pollution, but their diet of 72% carbs, and they still have the lowest rates of heart disease ever recorded in the medical literature, and their vascular age on average is about 25 years younger than the typical Westerner. So I'm just going to jump ahead here. And this is an interesting table comparing a plant-based diet versus a Mediterranean versus a low-carb dietary pattern. And the plant-based is equal parts tomatoes, spinach, lima bean, peas, and potatoes. The Mediterranean is 40% of the plant-based, but also a half a piece of skinless chicken, 1 teaspoon of olive oil, 1 cup of 1% milk. And the low-carb pattern is equal parts beef, pork, chicken, and whole milk. You can see there's no cholesterol in the plant-based diet arm. You don't need to eat any. Your body makes all you need. How about protein? The low carb is, remember, beef, pork, chicken, and whole milk. Oh my God, if I go plant-based, my muscles are going to fall apart. But you don't have to believe me about the protein. You can believe Patrick Baboumian. He's the world's strongest man, and he's vegan. How do I know he's the world's strongest man? Because he won the world's strongest man contest. How about beta carotene? It's subtle. Dietary fiber, your constipation will go away. Iron, oh my God, I'm going to become anemic tomorrow. Calcium, my bones are going to fall apart. So today, no one can deny the possibility of adequate nutrition and the prolonged maintenance of health and vigor on a vegetarian diet. That's a quote from the Journal of the American Medical Association from 1912. And this is a great quote from Dr. Kim Williams, the past president of the American College of Cardiology. I recommend a plant-based diet because I know it's going to lower their blood pressure, improve their insulin sensitivity, and decrease their cholesterol. And this is where I am up in the Bronx, and Dr. Shah is a little further south here in Manhattan. So thank you very, very much. Be happy to take some questions.
Awesome. Thank you so much, Dr. Ostfeld. That was fascinating, and I definitely learned a lot. There's some questions coming in. I'd like to start with a couple of my own that I've heard from patients just throughout this throughout the chapter. Talk to me a little bit about what you see as your biggest obstacle for your patients, and what is your advice to overcoming this biggest obstacle? And then will you also stop sharing so that we can see you a little bit more clearly?
Yeah, sure. I can figure it out. Sure.
Awesome.
Okay, great. So I'm gonna move. I think there's a weird reflection of light off of buildings. So by obstacle, you mean starting to live this way?
Yeah, sorry. Yeah. So when you recommend, I noticed, and I actually wrote about it in an article, that you work with the community on Saturdays with your patients and their families and give them free classes to talk about, okay, this is what the plant-based diet actually looks like, and this is why you should do it. But learning about it and doing it is a whole different thing. So what is that obstacle that you see?
So, I mean, I think you've nailed it. Behavior change is the holy grail of medicine. We all kind of know that eating more cal is good for us, but getting ourselves to do it is a problem. So, I mean, I try a variety of tactics. I'm by no means perfect at it. And if anybody has a secret sauce, please tell me. Unfortunately, our Saturday morning sessions have had to be on pause during COVID. We did it for many, many years, but it's now obviously on pause because of COVID. So, in clinic, there's the educational component. I talk with them about it. I try to find a specific goal, like what's their why, and how to help them get there, whether it's like a cosmetic thing, they want to look better, or they want to get off their diabetes medication, or maybe, sometimes there's a little bit of data that can help with erectile function, all kinds of different, whatever it may be. Try to find their why and, talk about how it could impact that. I give them very specific handouts with like literally boxes you can check off, like 3 servings of greens, check, 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 3 servings of vegetables, check, 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 on and on it goes throughout the day. Exercise, I ask them dental floss, there's a little bit of a link. I mean, that's like, I talk about that as like distant third place in terms of importance after diet and exercise. But anyway, so the checklist that they can literally just look at and check it off. I then the Saturday morning sessions were helpful because, then you could have a family member come. We don't have that anymore. I try to have some accountability where patients will come back for like a weight and blood pressure check, maybe every 8 or 10 weeks or so. And the real reason I do that is more for accountability than anything else. I also try to outsource some of the education and some of the documentary films, like The Game Changers and Forks Over Knives can be very motivating for people. And so I will encourage them to do that, to watch that as well. So that's really most of the arrows in my quiver that I use. I don't have the secret sauce. We did start an inpatient program as well in the hospital because, when patients are admitted, because, I would go and I'd round in the hospital and go raw plants. And, next thing I know, dinner is served and it's, chicken or whatever. And I'm like, this isn't helping me at all. So we developed plant-based meals for inpatients that you can now order through our order system. And and they also started serving them in the cafeterias for many years. They used to sell out, but now with COVID, they have to like prepackage everything, so it's like a little harder. But anyway, you can order it for patients, and it typically comes with a handout to give them a little context about the food. And but that wasn't enough. We wanted more education, so we also have the documentary film Forks Over Knives that plays on continuous loop on one of the inpatient channels on those TVs for free for patients, and it has Spanish subtitles because that's a meaningful language for our community.
Yeah.
So that's what we do. The typical hurdles I'll hear are cost. We'll go into that. Could be cheap. You can buy bulk. You don't have to get organic. You can buy frozen stuff. I don't even, talk about green juices and stuff. Their typical is, before people used to look at me like I'm from Mars when I would bring this up, but not so much lately because it's percolated more into the community.
Right.
Those are really the behavior change, cost, and general knowledge about it would be the biggest hurdle, I think.
Awesome. Yeah, that was a perfect answer. Thank you. And then just really something that goes aligned with that. What cultural barriers do you see with your patients, and how can we work to overcome those?
Yeah, I mean, those are hard. Um, and some of the populations where I am, having meat with their meals is part of how they grew up. But, and that gets into an educational thing. And that was particularly helpful with Saturday morning sessions because you could bring family along. And just because it's culturally what we did doesn't mean it's in any way healthful. And like, why wouldn't you want mom or little Jimmy to be healthier? Like that seems culturally relevant too.
Right.
So what interestingly for the inpatient meals, we developed them with like 4 or 5 different chefs throughout our system, each with different ethnicity and background to make it culturally relevant for our population as possible. But so, you talk about ways you can substitute or ways you can change, like if you, I don't know, there's dish X that has meat, maybe you could put in tempeh or seitan or tofu. It doesn't have to be the red meat, jackfruit or, there's like, there's been obviously an explosion in products that can be meat replacements over the years. And when I first started doing this, in the mid 2000s, like there was like not a lot, it was harder. And I honestly didn't know any other person in all of New York City who was a plant-based doc. To my knowledge, I was literally the only one. I'm like, that's insane. There's like 9 million people in New York City. But to my knowledge, I was. And now, of course, there's a ton of, maybe they were out there, I just didn't know them, but there's a ton of people who are plant-based great programs, Dr. Shah, Dr. McMacken, many other people in New York City, from RDs to everything. So it's just, so along the lines of an explosion of healthcare professionals more overtly talking about this, there's been an explosion of products that you can use to replace meat and other animal foods.
So we have a question that goes into some of our questions from the audience. Jesse is wondering if you've heard of Step 1 foods, and I actually took the liberty of Googling Step 1 foods.
Thank you.
You're welcome. It looks like bars or nutrition bars that have been clinically proven to lower cholesterol. So maybe we could broaden that question a little bit. We talked about the non-healthy plant-based diet versus the healthy plant-based diet. And these look like chocolate and walnut bars, for example, is one of the things that's advertised on their site, but it's processed, right? It says minimally processed, but it's still processed. So I guess things like that are advertised as super healthy and great for you and will lower your cholesterol. When should we be wary of that, and when should we be confident in it?
It's a good question. I'm not going to have a hyper specific answer. Some of that stuff, of course, sounds like marketing. I'm not specifically familiar with step one, but I mean, there's a continuum of, like a potato chip can be plant-based, but like fried to within an inch of its depth or something. So it's not going to be healthy, but a baked sweet potato would be. And so if you're thinking about an energy bar that's like mushed up dates and cacao powder and maybe some crushed walnuts, that sounds pretty good. That sounds smartly processed. And so you can look at the ingredients, and if there are 35 ingredients and half of them you can't pronounce the name, not smartly processed. If it's got 5 or 6 ingredients and you know what they are, that sounds like it's smartly processed in a continuum. So we certainly don't want perfection to be the enemy of good. And I have
Yeah.
plenty of junk food vegan products. I'll have a vegan cake and a vegan energy bar from time to time. And so I guess it's really looking at the ingredients and going from there. But there certainly are some that I think are healthy.
Yeah. Awesome. Thank you so much. When moving to a plant-based diet, are there certain percentages of different types of food that one should strive for?
I don't get into it in any kind of detail like that, in part because I feel like the harder you make it to do, the less likely it is for people to do. And there's a handful of things that I get worried about. I just make sure people are on a B12 supplement, and it's not unique to plant-based diets. People on animal-based diets can have B12 deficiencies, but on a plant-based diet, since you're not also eating dirt with spinach, because now the spinach is like quadruple washed, whatever, you're not getting B12. So I just haven't. That's something like I guess a nutrient of concern. And sometimes I'll have ask people to also take an omega-3 supplement, because not everybody converts the ALA and flaxseed meal to other EPA and DHA so well.
Mm-hmm.
Those are two nutrients I'm concerned about. If someone's on Coumadin, or if they have renal issues, there are a handful of medical situations where I'm cautious about proceeding. But in terms of, if someone has a varied plant-based diet, meaning like they don't eat romaine lettuce all day, every day, but like nobody does that. Uh, I'm, I'm not aware of any nutritional deficiency there would be, assuming you're supplementing B12. In fact, there's real reason to think that you'll be healthier. Now, the question of protein comes up all the time. And nuts have protein, vegetables have protein, whole grains have protein, beans, lentils have protein. So if you're eating a varied plant-based diet, you're going to be meeting your nutritional requirements. And I've never seen anybody um, like the joke is the protein deficiency ward in the hospital. That's empty. And I've only seen people walk out healthier when they're adopting a plant-based diet, but I don't get into like macro ratios or anything like that, because I think it just overly complicates it, at least for my patient population. And I don't want to create more hurdles. And if you're eating a varied diet, you're going to meet your nutritional needs.
Okay, awesome. Um, we have a question from Rick of how does this relate to multiple myeloma? And I'll just refer in where you're going to receive a follow-up email with this recording and resources. And some of those resources would be Dr. Urvi Shah's presentations about how plant-based eating results or affects multiple myeloma. She gave us a couple studies. Of course, because multiple myeloma is a rare disease, certainly more rare than cardiovascular disease, the studies are significantly smaller and there's still a lot of work to be done. But I will make it clear that there was improvement for multiple myeloma patients who were on plant-based diets. And to add to that, plant-based diets also help lower comorbidities. And as you lower the risk of these comorbidities, like heart disease, you're able to prepare your body to fight the multiple myeloma and accept these different treatments and be able to be qualified for more treatments that you wouldn't be otherwise. So that's kind of the wow, the lights just went out. That's kind of the background that I have for you there. But that will be sent to you. And okay, it came back on. I'm glad the internet didn't go out. um, we have another question. It's a little specific, so I'll try to make it more general. But this person has been diagnosed with hyperlipidemia.
Hyperlipidemia, it sounds like.
Okay. And has always exercised a lot, was not overweight, has some genetic feature or risks because of her family, and she began a vegan diet right away and saw some cholesterol. Her question, I guess, is about LDL. So let's ask this a little bit more generally. Will diet be able to lower LDL in patients?
Typically, diet can lower LDL cholesterol. And those randomized trials by Dr. Jenkins showed that with a portfolio diet, like a high fiber plant-based diet, it was able to lower LDL cholesterol a good bit. Now, genes also play, of course, a big role in LDL cholesterol. And I have some patients who, swear they're plant-based and their LDL cholesterol doesn't budge, and others where it falls a mile. So different people have different genetic floors. And even if you're plant-based, a minimally processed plant-based diet and your cholesterol doesn't fall much, it's a bummer, but I wouldn't be discouraged from a big picture health perspective, because you're still accruing benefit for all kinds of reasons: blood pressure, inflammation, diabetes. But you may not be getting it specifically for LDL cholesterol. And there are a lot of medications, particularly statins, for the appropriate patient. And I use them a lot in my patients. For the appropriate patient, they can be incredibly helpful, lowering cholesterol, lowering future cardiovascular risk. So I know it can be discouraging if the LDL doesn't change much when people go plant-based, and it does happen from time to time, likely because of a genetic contribution. But there are ways that we can address it, and you're still accruing benefit from other aspects of the diet.
Awesome, thank you. I know we're running late, but there's a couple questions that I feel like are pretty important. One being, do you recommend a gradual change in your patients, or do you recommend that they try to go quickly in order to, be more effective?
My hope is that they go all in. Now, if someone needs to take baby steps or bigger steps to get there, whatever it would take, I'm happy with, because we also know that every little bit counts. So whatever the patient really wants is okay by me, but my preference is they go all in. Why is that my preference? Because typically if they go all in, they begin to see changes within like a week. Like they'll feel thinner, they're starting to lose weight. Oftentimes within like 2 weeks, I'm getting a phone call that they're like lightheaded. And that's almost always because they're on high blood pressure pills, but the blood pressure is falling because of the dietary change, and they don't need the pills as much. So we start lowering doses. And oddly, like I'll sometimes have patients, like they'll call their primary care doctor, their blood pressure is low, and the primary care doctor will tell them to eat more meat and salt to raise their blood pressure up more so they can tolerate high blood pressure.
Oh my God.
Mind numbing. But anyway, so I'll have patients sometimes, so they'll see benefits so quickly. And so it's, I think it creates a virtuous cycle. The other thing is like a lot of these Western foods, they're addictive. Like they have PhDs in food science who work to make these super, super tasty foods addictive, and they are. It's like cocaine. Mm-hmm. So it takes a little while to break that addiction. So I feel like if you just go cold turkey, I say cold tofurkey, go cold tofurkey, it takes a month or two to break those addictions. So you just accelerate that clock.
Okay, wonderful. Thank you. A couple questions about iron. So we have one patient that did this plant-based diet, but his labs showed significant what is leading towards anemia. And so even with those leafy greens, he tried an iron supplement. It just seemed to not be able to catch up. Do you have any recommendations for people in this situation?
Yeah, I mean, as a cardiologist, it's a little out of my area, but it can be very iron dense, the plant-based diet. Now, the form of iron that you get in a plant-based diet is different than the form of iron in an animal-based diet. The form of it's ferric and ferrous iron, I forget which is which, but the animal-based diet, the iron there, it's better absorbed, but it's more inflammatory. And there are associations of the iron from animal-based foods with more heart disease, diabetes. These are associations. And the iron from plant-based foods is not inflammatory in the same way, but isn't as well absorbed. But if you take these foods like spinach with some vitamin C with lemon, that can increase absorption. But of course, if someone having significant iron absorption issues, devil's in the details there. But in terms of but vitamin C and lemon and stuff can increase absorption of iron from plant-based foods. So, you know, but I really don't want to comment further because I just don't have enough information. And iron can go down a little bit on a plant-based diet typically, but it's not typically associated with anemia. And it may be helpful, may not, but it sounds like in this case, it's a good bit low, and supplementation and input from a hematologist is helpful.
Awesome. Thank you so much. And I know we didn't get to all of the questions, but I really do appreciate each of the participants that are joining us here today and Dr. Ostfeld for your time. We'll just end with a couple of slides here, just as outro announcements. All right. So you can join us for our next Nutrition and Wellness for Myeloma event on August 24th, 2021. We're going to be continuing the conversation of how we can make plant-based eating more manageable. What staples do you need in your kitchen, and what tips from the experts will make the transitions more manageable? The nonprofit Plant Powered Metro New York will be presenting to us. They are a great organization referred to us by Dr. Shah. And again, I'm just really excited to continue that conversation. So that's on August 24th at 1 p.m. Eastern. You may be interested in other Myeloma Crowd community events that we have coming up. Because we're over, I won't go through all of them in detail. Tomorrow we have our African American chapter event where we will be talking about fitness and nutrition and how it's going to be beneficial. And then on August 3rd, we're going to be talking about Social Security and what our options are for retirement income with myeloma financial coach Diana Valentine. August 4th is our Fitness for Myeloma chapter. This one's a little bit different. We're going to be doing mental health, how we can protect our mental health when living with uncertainty, and that's from licensed social worker Susan Ashley. And then the 10th, we're going to have our SoCal Myeloma Community Chapter. Head of Product here at HealthTree, Todd Foster, is going to be talking about the power of HealthTree Cure Hub and how we can use it to accelerate a cure for myeloma. The link to sign up for any of those events is found at the bottom of the slide and will be sent out within 48 hours of this event ending. Another thank you to our sponsors, Bristol Myers Squibb, Amgen Oncology, Genentech, Adaptive Biotechnology, Sanofi Oncopeptides, Karyopharm Therapeutics, and Takeda Oncology. And thank you again to each of you for helping us build a strong myeloma crowd community. And thank you, Dr. Ostfeld. I appreciate you all and hope that you have a great rest of your night. Bye. Thank you.
Thank you.